I'm Dr. Doug Austin, and I'm here today with Matt Gilman, who is our Clinical Embryologist at the Fertility Center of Oregon. And today we want to explore with Matt what the role of the embryologist is in an IVF center. So Matt, what does an embryologist do?
An embryologist takes the sperm and eggs from patients. We combine the two together to make embryos. We carry those embryos out through 5 to 6 days before we transfer them back to the patient or freeze them by vitrification.
The embryology laboratory is clearly a highly technical and sophisticated place. What is it like to have people's embryos in your care?
It works for me because my kids give me joy and I want people to have that joy.
That is an incredible statement. And that is the joy that we have here every day, because we're able to help people who desperately want to have children, build families, go on with their lives, ease the trauma of the infertility. And you think about that daily when you are nurturing the embryos.
Yes.
When we deliver the eggs and the sperm in the IVF procedure room to you, how do you make use of those tissues?
We get the eggs from Dr. Austin and we separate them from the follicular fluid and store them for about 2 hours before we strip the cells from them, and then we inject the sperm from the patient into the egg, which then is going to be stored overnight until the next day when we find out if fertilization has taken place.
And is fertilization assured in the embryology laboratory?
Fertilization is not assured in the embryology laboratory. Many processes have to take place between the sperm and the egg for fertilization to take place. It's about 75 to 80% of the mature oocytes that get fertilized.
So Matt, when you receive eggs in the laboratory, what is the assessment of the quality or the quantity of eggs?
It is at first difficult to determine if eggs are mature or immature. We let them sit in the dish for 2 hours, and then we can assess at that point, after we strip the cells around them, whether the oocytes are mature or immature.
So maturity means that the egg can actually be fertilized, right?
Yes, all oocytes that are mature will be fertilized in our laboratory. All immature oocytes cannot be fertilized and will then be discarded.
And how do you determine what is a mature egg? Under the microscope?
Under the microscope, we can see if there is a polar body in the oocyte, which is just a bleb of genetic material that has been extruded from the cytoplasm. If that is present, we will then do ICSI on the oocyte.
I understand at times that you actually have to physically deliver the sperm to the eggs through the ICSI or intracytoplasmic sperm injection technique.
Yes, the sperm that are not as motile or progressive as we would like, we have to immobilize those sperm and we put them into a needle and inject them into the cytoplasm of the egg.
I know that there's a lot of safety mechanisms in the laboratory. You know, you hear about national incidences where the wrong embryos are given to couples or maybe fertilization with the wrong sperm. How do you make sure that that does not occur in our laboratory?
Everything we do in our laboratory is documented, signed by 2 people when sperm is being injected or placed into a dish for injection for that patient. All plates that we have are named, and we have a color coding system also with our charts. We also have an alarm system in our lab which will inform us if any of our incubators go out of the normal range. And then we also have a generator system which automatically kicks on if we lose power to our building.
Thank you very much for joining us today for a discussion about the role of embryology at the Fertility Center of Oregon. It is our honor and privilege to serve our patients both in the laboratory and in the exam room. We welcome you at our clinic and we hope that we can help you complete your family.